The human brain requires blood sugar or glucose for energy. And if you don't have enough glucose coming into brain cells, then really you can't think and remember properly, and you don't have the energy that your cells need to replace worn out parts. So naturally your brain will degenerate in the absence of enough energy in the brain for repairing your cells. We know that people with Alzheimer's disease have a brain deficiency of insulin, and they have a decrease in insulin signaling in the brain, and therefore it's not surprising that Alzheimer patients do not think and remember well, and that they are unable to repair worn out parts, and that their brain cells then degenerate. One of the things that we have found is that if you replace the missing insulin by giving Alzheimer patients a nasal spray containing insulin, where the insulin is able to go up the nerves involved in smell directly into the brain, that this treatment actually improves memory, attention, and functioning in people with Alzheimer's disease. Naturally, since insulin is so important for maintaining good brain functioning and memory, it's not surprising that people who have diabetes, where they have a deficiency of insulin signaling and often also insulin production in type 1 diabetes, that these patients are at twice the risk of developing Alzheimer's disease later in life. We also know that animals that are diabetic or that are made diabetic through a treatment, those animals, their memory will decline with aging. And if you give them intranasal insulin, in fact, you can prevent that decline. And they will remember when they're older just as well, even as young animals. So some people have started even to call Alzheimer's disease diabetes of the brain or type 3 diabetes, to sort of indicate that in patients with Alzheimer's disease, there is a deficiency of insulin signaling. We hope that one day the intranasal insulin treatment that was developed at our Alzheimer's Center may be able to be used to help reduce the risk of Alzheimer's disease. Right now it is being tested as a treatment. That is, if we administer the intranasal insulin, does it in fact improve memory? But we'd also like to know in the future whether if we take people that say have diabetes or are at higher risk and give them intranasal insulin before they develop Alzheimer's, can we in fact delay or prevent that?